We'll just go around the table then, and please introduce yourselves so we can establish our quorum. My name is Gabrielle Sanchez Sandoval, and I'm with the Department of Health, Office of the Secretary.
I'm Vanessa Padilla, the HR Director for Department of Health.
I'm Mary Beth Densmore, I'm the DFA Analyst for the Department of Health.
For the PLD Facilities Fiscal Officer.
Charles Jaramillo, DOH, CFO.
Susie Archuleta, New Mexico Behavioral Health Nursing Home Administrator.
Francis Tweed, Executive Director, Administrator at NMBHI.
Michelle Fields, Medical Staff Office.
Jeff Esquivel, Application Support for ITST.
Carmela Sandoval, Sequoia Administrator.
Shauna Hartley, Hospital Administrator at Turquoise Lodge and Interim Operations at LLCP.
Tammy Alikar, new Administrator for LLCP.
Welcome.
Thank
This
you.
is Tammy's first meeting, and probably for a lot of you, the first time we'll be meeting.
Jose Garola at New Mexico Rehab Center, Hospital Administrator.
Todd Winder, Administrator, Fort Bayard Medical Center.
Angela Solis, Secretary.
Curtis Gant, Finance Director for New Mexico Rehab Center.
Melinda Walensky, Assistant General Counsel.
And George Wayman, Deputy ASD Director.
Good morning, everyone. Has everyone had an opportunity to review the agenda for today, and if so, can I get a motion for approval of the agenda?
Motion to approve.
Second?
Second.
All those in favor say aye.
Aye.
Anyone opposed? Seeing none, the agenda is approved. Moving on to item number 3, approval of minutes from our previous meeting. Those were sent out, so everyone had an opportunity to review them. Does anybody have any changes to the meeting minutes? Seeing none, can I get a motion for approval of the meeting minutes from April?
I can make that motion, Francis.
And a second?
I second.
All those in favor?
Aye.
Anyone? Any objection? Seeing none, the meeting minutes of April approved. We'll move on to the new business reports. Lynn is on the phone. Our Cabinet Secretary, Lynn Gallagher, is on the phone. Sorry, I failed to mention that earlier. Lynn, did you want to say anything? We don't have anything, a specific report we wanted to provide, but I don't know if you just wanted to say good morning, great evening.
No, I don't have any updates. Thank you.
Thank you. So of course, we did introduce Tammy as we went around the table. She introduced herself. But Tammy, I don't know if you want to just say a couple of words about what your background has been and let everybody know a little bit about yourself.
Sure. For the last year, I've been working with Department of Corrections. I was at the women's prison in Grants, and then I transferred to the RDC in Los Lunas. And before that, I was a hospital administrator for a psychiatric hospital in Memphis. And before that, I worked with people who have intellectual and developmental disabilities, both in the community and institution. And I helped close the institution down and move everybody to community placement with providers.
Thank you very much, Tammy. Welcome. We'll move on to our facility administrator reports. First will be Todd, Fort Bayard.
Ready? This is the fourth quarter report for Fort Bayard Medical Center. First of all, just a brief overview of our services. Once again, we do offer skilled rehab and extended care in a 70-bed unit. 10 of those are short-term rehab beds. We also have our dementia care unit consisting of 90 beds with a special block hallway for 24 behavioral male, 24 behavioral female, 2 separate hallways, and then the other 42 beds are of high and low complexity. We also have our veterans unit, which is 40 beds. Up until just recently, it has been an all-male unit, but we do have our first female resident on that unit now. She's a wife of one of the veterans, so. Next is our licensing and certification. For our Center for Medicare and Medicaid, or CMS, we had our annual survey from the 30th of May to the 10th of June. This was our first survey under the new long-term care survey process, which was implemented in November of last year. We had 15 findings, nothing really bad, which after I thought about it, I guess I didn't find it too bad under the new regulations, learning their new processes and that sort of thing. So at first I was a bit taken back, but once I thought about it, it's not quite so bad. There were no substandards, so that's what the most important thing was. We also just had our, about a month ago, our veterans survey on the 19th and 20th of June. Of course, they were much nicer than the CMS surveyors. No significant findings there at all. We have not yet received their official written reports. We're waiting on that so we can respond. And we also had our fire marshal visit on the 11th of July, and there were no significant findings on that either. Here's our utilization for the 4 quarters. Our patient days in the 4th quarter were up. In fact, it was our busiest quarter of the year. We had 20 admissions and 23 discharges in the quarter. Our average daily census for the 4th quarter was 132, which was gradually increasing through the years, as you can see there. It's our percent of available beds at 88.67. Here's our brief look at our finances. Our revenues were up in the 4th quarter. Our expenses were up a little bit as well. We had some unexpected expenses, the settling of a lawsuit is on there, as well as some repair to our expenses. Our indigent services for the 4th quarter were just over 800,000, which accounted for 17.84% of our revenue that goes towards our indigent services. Collections for the quarter were 100.17%, which gave us a collection rate year-to-date of 95.03%. We felt was good. I think our goal was 92, so we felt good about that for the year. Human resources, we currently are staffed at 245 full-time equivalents. Our turnover for the quarter was 2.4%, with a year-to-date turnover of 2.51. Currently, our direct care vacancies account for 37 FTEs, which is 21%. Indirect care is 24 FTEs, 18%, with a total vacancy of 61 positions, or 19%. Our clinical indicators, our actual PPD for the quarter was 4.02 overall, with an acuity of around 3.06. Again, our bed availability was 89, just over 89%. In infection control, 4th quarter was crazy for infections. We had I don't want to say it was a breakout of C. diff, but we had several C. diff patients that were admitted to the facility from the hospital, which made things interesting. We had as many as 5 at one time. We've got that back down to, well, there's no C. diff anymore. But for the quarter, the total infections were 78, and with the 6.48 infections per 1,000 patient days. 94% were hospital-acquired infections, with the multi-resistant organisms of 5. Our resident satisfaction, for the resident, the quality of life is 89%, quality of care was 78%, quality of service was 84%, with an endorsement score of 10%. And again, just as a reminder, the endorsement score is the difference between the people that are highly satisfied and the difference between the people that are not satisfied. So you always want that, the higher that percentage number is, the better. Our family satisfaction, quality of life is 93, quality of care is 84, quality of service was 90, with an endorsement score of 29. We find that the lowest point we had there was our quality of care with the resident satisfaction, which was a 78, and we have attributed that to them not feeling like they have enough choice, their own choice out there. So we'll work on that. Some of our training initiatives, we're working on employee performance. That was one area that was cited on our state CMS survey, that those not getting done and then not being used in order to determine the training that is needed. That seems to be one of their hot spots on the new survey process, so be aware. Our annual CMS requirements, we're still working on those. Clinical competencies, which is kind of connected to the employee performance side, as well as increasing our customer service scores. And that's it. If there's any questions.
Are there any questions for Todd? Thank you, Todd, I appreciate it. Now moving to Turquoise Lodge and Shauna Hartley.
My name is Shauna Hartley, and I'm presenting the fourth quarter report for Turquoise Lodge Hospital. We continue to provide the same service provisions, 16 medical detox beds, 16 social rehab beds. We have our outpatient social detox clinic that runs every day from 7:30 to 4:30 or until the last patient is seen. We have our intensive outpatient program that is 4 days a week, and we have our outpatient medication management clinic that's running 3 days a week now for 3 hours. Significant service provision highlights this quarter was that we added an extra day to our intensive outpatient program for family, and we also retooled our treatment plan for our clinicians so that they could be more efficient. If they were to do an assessment in medical detox, it transfers into our social rehab program, and in turn it also folds right into our intensive outpatient treatment plan. Our inpatient data is we basically have stayed pretty steady at an 83% occupancy rate for the entire hospital, which is above average. Our rehab census dropped a little bit this quarter, and I do contribute that to our clinicians becoming more skilled at assessing the individuals with our ASAM criteria, which tends to increase the exclusionary criteria. Our demographics stayed pretty steady this quarter. Significant events to report is our transgender admissions have been up, and we've had a slight decrease in our Native American population. With our drug of choice, our age data, we continue to service pretty much the same population between 21 and 60. The one data point to point out is that we are increasing our numbers of consumers between the ages of 51 and 60. Our alcohol primary dependence was up this month with a little slight decrease in the opiates. This is our outpatient data for our IOP program and for our MOTU. And the significant information to report on that is our numbers for MOTU are a little bit down. That tends to happen when it gets warmer with that clinic. And we had a little slight decrease in our comp assessments for our IOP program. But again, I think that contributes to our staff actually becoming more efficient in identifying the consumer for the right service. This is Turquoise Lodge financial information for this past quarter, and our collections have remained pretty steady. We did have a bit of a dip in our revenue collection, but I think that that's contributed to last quarter with March. We had a significant increase in revenue collections, which were just past MCO checks that they owed us. But we continue to stay steady with our collections, and we created a surplus this fiscal year. With our hospital contracts, the only significant information on that is our temp employees was up a bit because we had 2 vacancies, one in our finance department and one in our medical records department. And we have a decrease in our agency nursing. We were fortunate enough to hire 2 nurses this quarter, 1 housekeeper, 1 site tech, 1 nurse tech, and our vacancy rate has stayed pretty steady at about 26%. When it comes to marketing and outreach, our outreach team has done fabulous this last quarter. Normally we do about 9 contacts every quarter, and this quarter we actually did 20. We've really been stepping it up and going to the big shows when it comes to the larger community recovery events. And I feel like the staff have really become partners with a lot of community members that we hadn't had before. So in relationship to marketing and outreach, we had a PDSA. We had a PDSA in our quality department to monitor that, and we certainly exceeded that expectation this quarter. What that has resulted in is that we've had an increase in referrals from our Veterans Court and our Drug Court. We have been able to supplement our outpatient resource list. Because of these new relationships, some of these folks have been coming to our hospital and providing increased education to my clinical staff. We actually have been reaching out to all the communities that we haven't been servicing, and we're becoming more well-known. The increased marketing and outreach has also resulted in improved collaboration with the MCOs, and my staff have become much more skilled in marketing our facility. Any questions?
No questions, Shauna. Thank you, Shauna. Next, we'll move on to the Los Angeles Community Program, and both Tammy and Shauna will present. I just want to say thank you to Shauna for agreeing to handle the interim position at the Los Angeles Community Program. Any transition is difficult, so I appreciate you stepping up and helping continue to help through this transition. Thank you very much.
So I'll be presenting the report for Los Lunas this quarter because Tammy and I agreed that it'd probably be better that I do that because I covered the majority of that. I wanted to start off by saying that, we introduced Tammy Alikar. She's our new administrator at LLCP. She comes to us with a wealth of knowledge and information and education. And Tammy, I don't know if you wanted to comment any more about your background or your skill set.
Gone over it.
Okay. Welcome. Thank you. So I'll be staying on to assist Tammy, acting as her interim operations person, and also to support her in this transition. So LLCP continues to provide the same service provisions. We have supported living. We have 26 supported living homes that are sprinkled out throughout Valencia County where our consumers reside 24/7. We have our crisis residential, which is a 90-day respite program. We're a crisis provider for the state of New Mexico. So in the event that there's an individual with a developmental delay that is in crisis, then we can take them in temporarily. And at times, these individuals become our residents. We also have a day HAP program where it operates 5 days a week. Our staff pick up individuals in the community, our existing supported living individuals, in addition to other folks who participate in a day program that goes from 9 to 2. We have an integrated employment program where we have job coaches who are assisting our developmentally delayed individuals in the community with their employment. And we also have an ICF that has a census of 4, and we are today at 3. It should be noted that in this last quarter, we were successfully capable of transferring all the HR assets and property over to DDSD for the dental clinic, and so LLCP will no longer be overseeing that system. Our census information pretty much stays pretty steady. Our residents live with us for long periods of time. We have 59 individuals in our supported living program. We had 1 crisis residential individual. We have 57 people in our day HAP program, which is 2 less than we had last quarter. We have 26 people in our integrated employment program, 3 people in our ICF, and 34 of our individuals are Jackson members. We've had quite a bit of activity when it comes to licensing and accreditation with our LLCP program this last quarter. We remain in full compliance with the conditions of our participation with our ICF. In this last quarter, we had a DHI Quality Management Bureau audit, and that actually started October of 2017. We received the report in April of 2008. And we presented DHI with the corrective action plan May of 2018. We received a letter a couple of days ago that identify that we have successfully moved through our corrective action plan, and so we no longer have that on our plate. We also have participated in an IQR audit, which is an audit specifically for our Jackson consumers. So we have submitted all the documentation successfully on 3 Jackson consumers, and we are anticipating our interviews with our staff and our consumers sometime in the next couple of weeks. This is LLCP's financial information, and our collections remain to be pretty steady. Actually, we are about $100,000 over than we were last quarter. It should be noted that last time when I presented this report, our uncollectibles and unbillable and charity care numbers were 0. However, Roberta Vigil has come to our facility and assisted our finance department in correcting how we're entering that information, which has resulted in more accurate numbers. So that's just something to report. In the last quarter, we have put in quite a bit of safeguards when it comes to the DAHAB billing. We've turned over the consumer checkbooks to the finance department, which is probably the right place for it for greater oversight. And we continue to retool our finance department and ensure that everybody who's working in that area is working within their skill set. This is probably the biggest accomplishment that we've had in this last quarter, and I want to say special thanks to George Morgan, who was my partner in making this a successful process. We successfully got everybody moved, the finance department, the quality department, the clinical department, the nursing department, to the LLC campus. So we had been leasing a building for several years and was able to move every single person who were primarily admin staff into that area. All the IT infrastructure is upgraded and completed, so thank you for Daryl and everybody who participated in that. We successfully put in utility meters for the individuals who actually occupy that space, and so on the campus we have state police, foster grandparents, bookmobile, and the New Mexico Men's Recovery Program. And so prior to this utility meter system being put in, LLCP was responsible for all the electricity and the utilities on the campus. And so now the individuals who are actually utilizing that space are going to be responsible for their utilities. And all the fire panel retrofits were completed in all 4 LLCP buildings. This is our vacancy rate for LLCP. We do note that our vacancy rate for the facility and also for our direct care staff has gone up a couple of percentages. And so we anticipate having a rapid hire in the next couple of weeks to address that. And I don't know if anybody has any questions.
Any questions for Tammy or for Sean? Program. Seeing none, thank you very much. Next, our behavioral health institute, Francis, please.
Good morning. Just a quick overview of the next slide of our divisions. We are considered the mental health safety net. We do have the adult psychiatric division, our forensic division, our care, which is our adolescent program, long-term care, and then our community-based services, which is our outpatient program. Average daily census by division, we've been averaging about 71 patients on the psych side, 54 at forensic. Care has been averaging around 7, long-term care 141 for a facility total of 272. Outpatient information, we have about 985 patients that are seen by psychiatry, 156 receive psychotherapy. Our CCSS program has 13, psychosocial rehab 36, and we currently have a total of outpatients of 1,060 that are receiving services. Joint Commission and Licensing, we finally did just complete our ligature project last week at the Adult Psychiatric Division. We have requested additional funding because it is going to be expanded into behavioral health. So we anticipate by our next survey, which is a couple years away, they will be looking at our behavioral health programs. We are also in process of completing our midpoint review report for Joint Commission that's due at the end of August, and literally we have to go through every single standard through Joint Commission and say that we are in compliance with it. So we do have a team looking at different standards depending on where it is. For example, our Environmental Care Committee is looking at the life safety standards, environmental care standards. And our corrective action plan for the long-term care DHI annual survey and our complaint survey that resulted in IJs, and that was from March 26th through the 29th. They finally did accept our plan of correction on April 18th. And our care certification survey, we thought was going to be this month because it's due by the end of the month. But earlier this week, I received notice that they're going to extend our certifications through December. So that tells me that CYFD must be behind on their surveys. Our budget, you can see that our general fund and our total projected other revenues have evened out, which is great news. So our operating budget is about a 57 million, and we did meet our budget this year. Uncompensated services provided for the quarter were 5 million, and for the annual for FY18 was 21 million. Of course, that's because we don't get any funding at forensic, and we do have just one indigent resident in long-term care. And as before I mentioned, we usually just get 3 to 5 days of payment for adult psychiatric patients. Sometimes when we get them from on a 30-day court order, especially from the south, they've already exhausted payment. And in some patients, we have difficulty trying to find a safe discharge for. So our contract costs for FY ended up about 4 million, and that gives you a breakdown of how we break that down. Our capital projects, our cottage renovations, here we are in mid-July and they're not yet complete. We thought we were going to do a walkthrough, a punch list this week, but we couldn't. So we're hoping by next week we'll get the cottages renovated, because we do have to move our ALF patients back into one of those cottages by the end of August. So, and we need to give licensing at least a 2-week notice. So we're going to probably barely make that deadline. Our roof replacements, we completed the ones that were pending funding approval for additional ones. Our campus surveillance system, we did complete our cameras that we had requested, but we're asking for additional in order to get cameras into our medication rooms, into the parking lot. So we're still working on that. And then Meadows Phase 3 is still in the redesign process. And our adult psych HVAC replacement is on hold until we complete the other cottage, which is Sierra, which should be completed the week after Zuni. So hopefully, what we're going to have to do is we have 6 different units at the adult psychiatric division. We have to move patients unit by unit so that they can do the HVAC system. So finally, after 3 years, I believe, we're almost there. And then asbestos abatement at our care program. We have been struggling to figure out how we're going to move the kids out of that building. We had anticipated working into one of our vacant buildings this storm. Ran into a few stumbling blocks, in that CYFD's licensing requires that we have a new license, and we cannot find blueprints for Crestone A. We've gone through GSD. We were told we had to do an IPRA request. We've done that, but they cannot find blueprints for Crestone A. So I did contact CYFD, and they said they might accept floor plans. We're also struggling to find a certificate of occupancy. So worst case scenario, if we can't get that done, we're going to just do half of the hallway at a time, which we did years ago when we had to do some work of care. So we'll just have half of the unit closed off, which is not ideal, but it's doable. So we're still working on that. Human resources, our year-to-date direct care vacancy rate remains around 24%. Nursing has the most vacancies, and we did hire a total of 44 people in the last quarter. We did hire 16 techs during our rapid hire in April, and we did have another rapid hire on June 25th, and we hired 19 techs, and we actually were able to hire 5 nurses, which is really exciting. That's never happened before. And they started working on Monday, so we're anticipating that that should help. And we do plan on continuing our rapid hires quarterly, and I think HC and Mary are going to be going to Las Lunas to help out with their rapid hire. We continue to advertise, and our ongoing interview process has been implemented. Our performance measures, our falls with injury per 1,000 days are at 0.17. Operational beds is 83%. vacancy rate I mentioned before, and then our revenues collected is at 89%, which we've not met that goal, but primarily because our finance department has been short. Our deputy finance director was out on FMLA for 3 months, and he finally did resign, and we're in process of interviewing and hiring for that position. And we continue to lose some billers because they get promoted. So we're still trying to hire 2 more collection people. And then just what are our patients saying about us? You can see that most of our, at APD Care and Forensic, everything's been over 90%. What we do is every patient upon discharge from the psych unit gets a questionnaire. Our patient advocate accompanies them if they need help filling it out. So I think that's why we do have quite a good, we have a good rate of response. And then at CBS, Community-Based Services, they've also done well. They started a new satisfaction survey process, and this is the first report that we've had, and they've done well also. Community Connections, Dr. Russell, who's our APD Division Director, did do a webinar for Health Inside of New Mexico, Beyond Alzheimer's, Dementia, and Behaviors. United World College students volunteer at our long-term care division and participate with the residents in activities. We do take our long-term care residents to activities at the Senior Citizen Center. Stampin' Up, which is something I just recently learned about from Susie, conducts craft activities on our long-term care units monthly, so that's a really nice program. The New Mexico State Library provides books on tapes for some of our long-term care residents. And then our CBS employees attend monthly Guadalupe and San Miguel Health Council meetings, and our CCSS employees from CBS facilitated special needs learning community meetings in May. Training initiatives, we are doing monthly training for our site techs on, at APD, and the focus this quarter was on bipolar disorders, understanding yourself with the bipolar patient. And then they also we have suicide and communication skills. We have an updated program for the new hires. Our security staff did get certification on how to use the breathalyzer. One of our therapists from the care unit attended a matrix model 4 training. Our infection control officer attended the APIC conference. Our plant employees went to some NPPA 70E training. Our social workers at CBS went to some training on chronic anxiety, and they also went to to another one on helping sexual assault heal. And our clinical director and one of our nurses on the inpatient side attended a seminar on changing how we feel by changing how we think. It sounded really like a good program. Our APD behavioral health therapists went to a training on mental health first aid, and then they also attended suicide assessment and intervention. So now the fun part, and I can tell you that there were a lot of activities in May, and I totally forgot about Nurses Week. After I submitted my report, I thought, oh my word, I forgot to talk about CNA Week and Nurses Week. So we did have activities for the nurses, for the CNAs. To give you an example, the administration and some of our directors sponsored a luncheon for our nurses, and some of the gifts that our executive administrator gave us. Something like this. So that's really, really nice. And all our CNAs and nurses on their individual units got pizza parties, ice cream socials. So we really did celebrate. And dietary was helpful in sponsoring and giving some small gifts also. So for our patient events, the adult psych and the care psychosocial rehab offered a Cinco de Mayo party, an activity at our farm, which was really fun. I mean, it was a great day. We went out to the farm. They were fishing, dancing. They had music. I saw one of the residents, from our not long-term care, but from one of our choices, just singing with the music and pretending he was playing the guitar. One of our patients from the ELF caught a little fish, and he was so excited. It was really a great time. And the dietary department and the patient foundation sponsored the luncheon. So we had a Mexican dinner, so that was really, really fun. Long-term care, psychosocial rehab offered fishing at the farm and outdoor recreation. They had an Easter celebration. They had a Mother's Day celebration, and then it was National Nursing Home Month. So they celebrated by residents sharing their life stories. So that was also really nice. At outpatient, they had a picnic in May, and they had root beer floats and a pizza party in June. We had our 125th anniversary, and on May 18th, the administration sponsored an Employee Appreciation Day to celebrate our 125th anniversary. We had photos, articles, other old items were displayed in the lobby. Snacks were provided for the employees by dietary, so they got to learn more about our history. So here's some pictures. You can see the staff looking at some of the bulletin boards that we had. And these are some of the old photos that we had. You can see that we used to have our own dairy cows years ago. And there they used to milk them, so they had milk. And then this is pictures of one of our old buildings that we no longer have. I guess they were able to demolish that before they got on the historic site. And then this is a picture, and I was like, what on earth is that? Those are beds, right? And those are buckets catching leaks in the I couldn't, so we've come a long way with our and then, and CBS Outpatient, they had a mental health month celebration on May 30th. It was outdoors. They hosted them, it was just really nice. They had a live band, and there was really some of the employees that were in the band. And they had dancing, they had games, prizes that were contributed from the community. They did horseshoes, they had a cakewalk, they had rock painting contest, and the therapist provided some relaxation techniques with the residents, and they served lunch, so that was also a lot of fun. And then with Mental Health Month, these are the classes that we had for our patients. They had, gives you an example of some of the things that the classes they had was importance of good quality sleep, fitness for the mind and body, exercise and leisure activities, importance of diet and nutrition, positive self-talk, tips to stay positive. The gym also did some classes for the patients on proper stretching. They discussed everyday stressors. They walked around the gym. And Voc Rehab also had some classes on therapeutic and healthy activities, food and nutrition, and learning new trades. On our Mental Health Month celebration, our theme this year was Fitness for Mind and Body on May 31st. NMBHI administration invited employees to walk around campus in honor of Mental Health Month. And it was also a memorial walk to remember and honor the 5 employees who recently passed away. Pictured here, I was very happy that Lynn and Gabby were able to attend. Pictured with Lynn, Gabby, and I as H.C. Hawkins, our deputy administrator. And then there's some photos of our memorial walk. You can see that we all started and ended at our administration building. And then there's another photo that shows the number of people that actually were walking around campus. And then that's the people that we honored during our walk. Any questions? So it was really fun. We had really fun. We're already planning the week of wellness. So we have the same group that worked on this. So we're already planning on celebration. Thank you.
Thank you, Francis. Does anyone have any questions for NMBHI or Francis? Seeing none, we'll move to Sequoia Adolescent Treatment Center and Carmela Sandoval.
We continue to provide the same services. We're a 36-bed adolescent treatment center serving all males between the ages of 13 and 17. I went ahead and put the this fiscal year quarters and census. So you'll see the whole year. We're ending up the Q4 with an average of 28 for our census. I also included here, which were really great numbers to see, the total residents served from fiscal year 14 through 18. You'll see an increase. We started in fiscal year 14 with 58, and this year we will have served 93 residents. Some of the things that we've done over the years is we've shortened our length of stay, being able to provide more services and maximizing the number of services that we provide for our adolescents in New Mexico. We did have, in fiscal year 17, you'll see a little asterisk. During that year, we only served 67. However, that was the time that we were doing some modifications to our lodges where we were giving them a softer approach, softer tone to them instead of a correctional feel to them. So there's where that year, that's where our initiatives were. We did have our fire marshal inspection in June. We had 3 findings of two of those findings were immediately resolved. We all, as well, are expecting our certification survey. We do know that they are running behind. Our survey is due for September. The last notification we received is that they were running 3 months behind, but it's looking like 5 months. Our goal is to achieve another 18-month certification. We also got inspected by Environment Department in June, which typically occurs twice a year. They, for no particular reason, they are doing now inspection 3 times a year, and they will be unannounced. I have indicated announced, but they are unannounced. They did share with us that they do not want to see repeat findings. So we're working really hard in our kitchen to make sure that our findings are not reoccurring. Our financial capital projects, if you'll go to the next slide, you'll see some great things that happen at Sequoia. Go ahead and move to the next one. We completed our courtyard project. We, if those of you that are aware or familiar with Sequoia, this area was just rock, which we had several problems with the rocks with the residents throwing and breaking windows. We replaced all our windows for 2 plexiglass. The next thing that we did, and with the support of everybody within Department of Health and GSD services, we were able to successfully lay sod. And if you go to the next slide, and you'll see there, it's totally changed the feel of the facility. It feels for the residents and for the staff that it's not a treatment center, it's more of a school setting, more of a little school campus. The residents are really dying to get on the grass, and we're trying to be really mindful on how that occurs, so that they want to play football and play soccer and want to make sure that it's the roots really grab and take. So we're doing a lot of leisure play right now. So we're really excited about this. It's really changed our environment, and now we're working on maintaining that. We also completed our repairs on one of our lodges. We had a water leak that licensing identified, and we completed that as well. The fire hydrants were a little bit challenging for us. They're due to be inspected yearly. We identified of the 3 hydrants that we inspected, 2 of them actually did not belong to Sequoia. The 3rd one we're still trying to identify. In our inspection, we found that the flow of the water and the gaskets were not operating to its capacity. So we had projected that to repair this hydrant would be about $13,000. It turns out that it didn't belong to us. So that was good news. However, what was challenging is to identify whose they belong to. But for a while, Sequoia had thought that these 2 hydrants belonged to them. So that was good news, and working with the community and working with GSD to identify that was really helpful, a great learning project. I think the next slides are the courtyard. Then we move on to human resources. Our vacancies have also increased. We do have 37 vacancies currently. Our challenging positions are nurses, the mental health technicians, and now our principal. Our principal decided to go back home up north and accepted a job with West Las Vegas School District. We are required to have an administrative license at our school district, so that is one of our priorities. We are in the works. Our previous principal has agreed to provide oversight for us and provide his administrative license and support the teachers and support, because we do receive Title IV funds. We do need to have that administrative license. So we are working with finance and hopefully getting a contract so that he can be able to provide that support. We were successful in hiring our DON, and she's been a great asset to our team. We were also successful in hiring 2 of our teachers have departed Sequoia for retirement. And we were able to hire 2 teachers, which that's really great because teachers are very hard to find. They're just like nurses. They're very hard to find. So we currently have 1 vacant teaching position and 1 principal, along with the techs and the nurses. Our performance measure data, I did go ahead and give you the overview fiscal year 18 overview. And we're tracking the duration of restraints and the number of restraints. We did, on Q3 and Q4, we did go up with the duration of the minutes of our personal restraints, and we don't use mechanical restraints. Our restraints are holds, and we did have during those reporting periods a particular resident that was challenging for our staff and did encounter several restraints. Removing him from that and considering him an outlier, our averages will still remain the same. Our highlights for the facility hosted a talent show. This was a second one that we hosted, in which we did have equal staff participation, and that was really fun to watch. Our education department hosted the spelling bee, our first one. That was really great to see. I was a little nervous about that and how we were going to align that with the education department. It wasn't the traditional spelling bee in the sense that the residents didn't know what words they spelled wrong. They had the committee behind taking score, and they worked really hard on giving the kids words that were at their level. And so that was hard to do, and making them feel like they were participating all at the same level. We've had a couple of presentations. The isotopes came and visited the residents yesterday, in fact, and gave a motivation speech, which was really great. And they gave every one of the residents a jersey. So that was exciting. And then we also had an outreach with Defender of Wildlife came and gave a presentation. The boys weren't really thrilled about that one, but they weren't interested in that one. But we continue to have community outreaches and support and wanting to come and give presentations for the residents. During our spelling bee, we had somebody within our Department of Health family donate home-baked cookies for the residents, each of the residents, and they were really unique in the sense that the kids could paint on them. They had an outline and they were able to paint with them, and the cookies were edible. And that was a donation from one of our DOH family members that has chosen to stay anonymous. However, I'm very thankful for him for doing that. So, any questions?
Hello, I'm Jose with the New Mexico Rehab Center Hospital Administrator. The NMRC continues to offer the same provisions, service lines, medical rehab, inpatient, which services those patients with hip and knee replacements, motor vehicle accidents, traumatic brain injuries, and debility mobility issues. We have a dedicated unit on that side, which has up to 15 beds. On our chemical dependency side, we have our medical detox as well as our intensive outpatient programming. Our inpatient medical detox, we have 8 dedicated beds to service those patients, which length of stay is averaging currently about 4 days. We're pleased to announce that we've opened up our inpatient social rehabilitation as of this month here in July. In late quarter of FY18, we started our plans to reopen the inpatient social rehab. The program's up and running. It treats those with substance or exploring the recovery options through daily programming with a multidisciplinary team approach. The goals are going to include increasing the patient's emotional and cognitive regulation by learning about triggers that lead to reactive states. We will assist these clients, giving them the resources, the tools, the coping skills to be successful in their sobriety. The program will be up to 28 days. For now, for programmatic and operational purposes, we're going to increase our census gradually through the next weeks to months. We're going to identify improvements in our workflows and processes, and along with hiring additional support to maintain a higher level of census. On our MRU side, so our admissions through this fourth quarter, they remain consistent with previous years. And as well as the past quarters, we did see an increase in the number of referrals that were lost this quarter due to patients not wanting to engage in the intense type therapy that we offer on the unit. we did lose some referrals to some skilled nursing facilities as well as other rehab facilities that are currently partnered with larger hospitals. We did, let's see here, we did have some patients that, a few patients that did not meet that CMS regulatory requirements for the therapy that we provide. So they were transferred to another higher level of care. But a large number of the patients that we serve on the unit are still Medicare and Medicaid. We have serviced indigent non-funded patients on this unit this past fiscal year, which is still currently higher than the regional and national comparisons. Overall, our positive efforts, quality of care stand out, and our FIMS, or our functional status improvement, on these individuals, as we're scoring at 99%, which is above the national and regional average in comparison to the 922 other inpatient rehab facilities that report to this uniform data system for CMS. Our goal, again, in that unit is to make sure that we discharge patients safely back into the home, to the community. So overall, we're about 83%. All right, for our chemical dependency unit, our detox census, again, remains consistent through the quarters. For 5 months in January, we had a doctor, Dr. Marilyn Hines. She's no longer with NMRC. She left as of May, but she contributed to some of the increase in our census of medical detox. We have identified areas in which we can further utilize a physician, potentially or increase our census. We're working with our primary doc currently and other contract service providers to assist in any kind of ongoing patient care. Again, our average patient census days in detox is currently averaging at 4, with 89% of our clients who are discharged, they report to follow-up care. 100% of the clients are transitioning to a lower level of care, such as PCP, IOP, now social rehab, and other outpatient providers. On our IOP side, continues to be successful. We're maintaining an average of about 35 patients continuously served. We've got 2 tracks with the max occupancy of about 15 per this past FY18. We serviced 435 total clients and about 108 new clients that entered the program. Counseling staff, the unit hours billed align with the number of required programming hours for an IOP program. The total number of IOP clients that completed the programming this year is 98. We hope to see an increase this fiscal year. So far, since 2017, we've had a total of about 202 complete IOP programming. Our finances this past quarter was probably NMRC's best in terms of revenue collection. We're still diligently working to increase our efficiencies, our admissions to discharge processes, all those processes that affect our collection have a direct impact on our collection rates. Curtis and his team have come up with some processes that further enhance this arena.
Yeah, we're reviewing all of our medical billing, the codes. There's with the new CPT books coming out, the new ICD-10 books coming out, we're going to be reviewing all the codes that have been removed and any codes that have been added that we can implement into our programming so that we're billing appropriately.
This is a shot of our budget finance or revenue collections for this year in comparison against FY17, FY18. We met our budgetary goals and exceeded our revenue collections by a large margin. Again, those contributing factors are including making sure we collect those past hanging claims, maintaining a consistent census on our units, our continuous documentation improvement, coding like Curtis mentioned, as well as staying on top of our billing collections or accounts receivable. Most importantly is our communications with our MCOs, making sure that if there's any questions, any denials, how we respond to make sure that they understand truly what types of services that we're offering. Our goals for this coming fiscal year 19 are to once again, meet our projected revenues, but maximize the true efficiency of the rehab center, on the operational needs. We're already looking into a 3rd track of IOP, how we can increase our MRU census with another provider, as well as reopening up our physical therapy, occupational and speech outpatient program. We have an aquatic pool which we can also offer outpatient aquatic therapy.
Further on, can you explain that chart?
I'm sorry?
Can you explain that chart?
Sure. Right.
Is there any separate years or?
Right. This is for FY17, FY18. Is there a way to?
Is it right? Can we do?
Yeah, go ahead.
Okay, so the way this chart is ran is you've got your monthly all the way across, and then you've got a total on the end. Your left column is the amount per month that was collected. The black that you see on there is FY18. The red is FY17. As you can see, we started out in July of last year, kind of matching what was being done, and we progressively got better and better. We did have a couple of months where we had some low census, which was these last few months, and that's our slow period during the summer. A lot of our patients on MRU especially are patients who have had surgeries for hip replacement, knee replacement, things like that. Summer months are the months that they prefer not to have those surgeries due to grandchildren, things like that, being out of school and wanting to spend time with them. But as you can see, we have the total on the end there is quite an increase due to our billing changes and implementing some of the codes and being more efficient with that.
Thank you. It's just on this copy here, it's not clear.
Right.
Yeah.
You know what? We'll apologize. We sent out when we copied and pasted it, and all the information didn't go across well. So we did submit the information online.
I appreciate it very much. Yeah.
Right. So our capital projects, these are some amounts that are rounded and projected, but we're working on quotes for the following items. Working with George Morgan, Denise Berdine, in our preliminary approach on replacing our camera badge swipe security system. We're going to be meeting in the future with others and working on the scope of work to try to capture our facility needs in that project. There's other identified capital projects that will require attention over the next few years. Our nurse call-bell system is on its 10-year lifespan mark. It's had a few issues. They've been fixed by an external provider. However, the replacement parts for the system are no longer available. Our medical beds are also reaching their peak year of about 10 years. We've been servicing those beds, trying to replace the electronics and air mattresses. And we're assessing the needs on how many beds are going to need. Right now we have we're assessing that we need 10 beds for future replacement. Our facility is also in need of some external upkeep in terms of the stucco and some of the window sills. There's a few cracks in the foundations on the walls, leaks, some window sill damage. This is all due to just the external environment, the weather, the community, the heat. So it's over this past 10 years. The facility was built in 2009, so we're reaching that 10-year mark as well. So just a little bit of TLC on that, and we'll be working with George, communicating those issues as we move forward. The licensing and accreditation. We're currently Joint Commission accredited. We've got deemed status through Medicare. NMRC will be conducting our annual trainings and competencies, including an internal mock survey coming up here November, December. This is just to identify areas for improvement that need immediate attention or that we can improve our processes on. Before the start of FY20, we'll be looking into contracting an external reviewer just to identify other improvement areas. Goals again are just to continue maintaining accreditation and complying with our regulations, as well as our MCO requirements. Most importantly, we want to proudly display our gold standard of patient safety care within our community. The performance data, Joint Commission, we're still currently working on our fall risk management for inpatients, outpatients at our facility. Quality Director, we're currently collecting data, doing root cause analysis for any falls or potential falls. We'll be spearheading new ideas to meet a higher reliability organization. Some ideas that we've come up with include, posting up to the staff, making them aware of the number of days that we have without a fall on the units, and offering some incentives to, 30 days without a fall or 60, 90 days without a fall, incentivizing each department. Other things include, you know, a customization of patient communication boards within the room to further identify any fall risks, any functional status abilities improvements that need to be made. This is all to make the doctor, the nurses, techs, therapists all aware and identifying all the risk factors for falls. All right, our med reconciliation process, it's also being enhanced to meet the new Joint Commission standards. This is important, as you know, for our admission discharge, making sure the patients are treated correctly, educated, informed on any kind of new medication started or already taken at our facility. This is ultimately going to help decrease med errors, which increases outcomes for patients. Our handoff communication, it continues on our clinical units as well as our functional status improvement scores. As you can see, we're at 99% on our MRU side, which again increases better outcomes for the patients. Our next slide, patient satisfaction remain consistent. Now we have opened up social rehab unit, which we'll be reporting next governing board. Right now, our HR department is currently implementing this new employee recognition program that will be collaborating with our internal employee incentive committee. We've identified some employees who have gone above and beyond and received some positive comments on the patient satisfaction surveys. So our goal this year again is to increase the recognition and also increase the satisfaction of working in our facility. Human resources, hiring OTs, nursing, counseling physicians up to even a mid-level is still our priority at our facility. As you know, the direct care physicians, they impact our operations as well as our census. We're still marketing in our community within the region, any physicians. We're meeting with physicians, potential clinicians that are interested in joining our group. That will be ongoing. As far as our needs and challenges, again, we're just prioritizing our direct care staff because this impacts, as you know, our operations and census. And talking with our local hospitals in the area, as well as healthcare facilities, other outpatient doctors, they're experiencing the same challenges as we are in the region as far as recruiting. It's kind of created this competitive market to attract and even retain employees at our facility, as a private sector has incentives that are within the region that are dominating our spots there. But I'll be meeting with and touring the facility with an interested physician on Monday. We have a local mid-level who's interested in joining our group. It's currently in the HR process. As far as marketing outreach within our community, we continuously meet with our 5th Judicial District Court. We're assisting in helping them develop and start up their adult drug court, which goes live August 13th. Our services to be provided will include our programs such as med detox, social rehab, but primarily IOP. They've kindly all volunteered and certified 2 individuals for MRT, which is moral recognition therapy. Currently, we have a counselor who is in training this week, and as of Monday, he's certified MRT. Our goal in the future will be to offer additional MRT program with this population and into the community. We're in discussion with our foundation, setting up an open house type event sometime maybe mid-September to invite guests, local guests, providers, hospitals, other healthcare agencies, including the mayor, just to share what our services that we provide, give them a little bit more information about what we do in the facility, give them a tour. And it's just to promote our facility, the organization, and the wonderful services and people that are in our facility. All right. NMRC, we participated this quarter in the Mayor Health Care Solutions Committee that we're actively a part of. We had a meet and greet with the UNM physician students who are all pending graduation. This is an effort, it's a collaborative effort with all local hospitals, healthcare agencies, and community to try to attract more physicians into our community. We're experiencing a high shortage. Burrell College of Medicine was also participated last month in bringing some of their third-year med students to Roswell. So we're trying to collaborate, trying to bring in resources, not just our needs, but the community needs. Success, well, in reflection of the past FY18, we identified, we met several goals. We did concentrate and enhance our workflow processes, documentation improvement, both in med detox, IOP, MRU, just to meet our regulatory standards, our revenue payer requirements, and patient care areas. Joint Commission CMS accreditation were key milestones for the facility, as well as meeting budgetary financial goals was the main priority. Sustaining and maintaining a census with staffing levels to meet operational needs was also a priority. Hiring, decreasing turnover rate, building stronger community relationships and better referral bases, increasing our patient satisfaction, our employee safety satisfaction. Just to name a few, decreasing overutilization of contract services, and not to mention the final, planning and the reopening of social rehab. Our future goals for this year, programmatic goals, will include, ongoing enhancement of our social rehab, opening up that third track of IOP, reopening our outpatient physical therapy, occupational therapy, aquatic therapy program there. MRT program, we're going to look into that as we get more individuals certified at our facility. Operational needs will still be to hire a physician, mid-level and direct care staff to further increase our census occupancy revenue to meet budgetary and financial goals. And that's it. Any questions?
Yeah, so just trying to get an idea of on your slides labeled quarterly census. Just trying to get an idea of what like average daily census is.
Sure. Which on what unit?
On both the, well, I guess all three. The
Sure.
MRU and the,
So our MRU currently, we're running an average of about 7 patients in this fourth quarter. And right, and that's with keeping in mind the acuity of the type of patients with the staff support we currently have in place, as well as the physician. As you're aware, we're currently looking for another physician and another mid-level to assist our primary care provider in helping to increase strategically our census so we can potentially fill those beds on that unit.
how many beds are there?
There's 15. Currently staffing wise, with the staff that we have and the acuity level, our max that we can safely take care of patients is up to 8.
Medical detox?
Medical detox, 8. We got 8 detox beds and we can fill those with 8. Currently, right now, we're at 5 patients on the detox as of yesterday.
The average daily census is?
Average, it ranges from 4 to 5.
4 to 5.
Right. IOP 35. Social rehab, right now we're at 4 patients, which is going to increase dramatically as we move forward.
15 on that?
Right, 16 beds is what we have dedicated for social rehab. You're welcome.
Is there anything else for Jose? Thank you, Jose. And that concludes the administrator report. So can I get a motion to approve collectively all of the facility administrator reports?
Carmella.
And a second?
I second.
All those in favor? Hello?
Aye.
All those still awake? Okay, does anybody have any questions or concerns about accepting the reports? Seeing none, the facility administrator reports will be accepted. And now to Charles for the program area 6 financial report.
Okay, so our financial report, as of just the other day, we're projecting for our facility a surplus of 2.6 million. And of course, this is still dependent on, the closing of our fiscal year and encumbrances and, our AR still, materializing. So we're projecting at this time a surplus of 2.6 million. Okay. Last fiscal year, which was FY18, our general fund was a little over 54 million. General fund for our lease at Fort Bayard was a little over 4 million. Interagency transfers, 1.1 federal dollars, a little shy of 4 million, and our other state revenues, 60.8 for a total budget of 124.1. The next slide is just a detailed of what our operating budget was from OFM all the way down to LLCP, Department 69, and how it was broken out by general fund, interagency transfers, federal fund, other state funds. So I'm not going to go through it in detail. Our FY19 operating budget, we have general fund of 55.5. The same holds true for general fund at the Fort Bayard lease at a little over 4 million. Our interagency transfers 4.4. Our federal dollars a little over 5 million, and our other state revenues at 58.7 for a total budget of 127.8 million. The next slide is the same as the previous one for FY18. It's just a detail of where our money lies, budget, should I say, from general fund all the way to other state funds. Any questions related to the budgets and the projected surplus? What it is that you could say is that, everybody can attest that we're hearing all our administrators is that we're doing well in our collections. Another thing that helped us out this year was our land income. NMBHI received approximately about $1 million more than last fiscal year, and this is attributable to our oil and gas and what the state of New Mexico is currently at. But of course, this is always a moving target, and it's a volatile revenue source. Our performance measures too. Yeah. Our performance measures, vacancy rate for direct care patients, our target was at 10%. We actually are at 23.7. The percent of eligible third-party revenues collected at all facilities, our target's at 93, and we're a little bit over at our collection target. The percent of long-term care residents experiencing one or more falls with major injuries, our target's at 3%. We're a little shy of 4%, so that's a little bit high than our target. And the percent of operational beds occupied, our target is at 90%, and our actual is at 79.7. This is a little tricky regarding our operational beds because at NMBHI, even though we have operational beds of X amount at forensic and X amount at APD, the lower the census we have there, the better the facility is actually doing. So it skews this number a little bit.
It's also a reflection of the vacancy rate. Residents, we have the staff to support them.
And that concludes our report, and I will stand for questions if anybody has any.
Any questions?
Hi, this is Dr. Babak Miran.
Okay, thank you. Just a minute, Dr. Bayard.
Okay.
You see no questions regarding the appropriate 6 financial report. Can I get a motion to approve the financial report? In a second?
Second.
All those in favor of approval of the financial report, please say aye.
Aye.
Anyone opposed? And thank you, Dr. Meir, for joining us on the phone. Are there any policies that the governing, I know that policies are usually sent out before, but do you want to just read the list of policies if it's not too long? You have it?
Yes, the policies that I'm aware of are New Mexico rehab policies. Do you want me to name the number of policies that were
Sure,
reviewed?
yes. Yes, thank you.
The policy 10-3 screening, policy 10-4 admission criteria policy, 10-6 client approval process, 10-7 patient orientation, 10-8 pre-admission drug and alcohol screening, 20-2 treatment planning, 20-3 interdisciplinary treatment team staffing, 20-4 behavioral management and treatment interventions, 20-10 progressive patient counseling, 20-14 searches, 20-18 individual counseling, 20-19 group counseling, 20-21 therapeutic recreation for patients. I was not personally part of the review of the policies, but believe they were reviewed correctly.
Yes.
And there is no issue reported to me about anything wrong. Can I have a motion to approve these policies?
Make a motion, Francis.
I second. Shawna seconds. All those in favor of approval of the policies that were sent and reviewed by those here and the Office of General Counsel, please say aye.
Aye.
Anyone opposed? Seeing none, the policies are approved. Thank you, Dr. Mayor. And if you can present
Yes.
the individuals who are up for credentialing or re-credentialing as well.
Yes, no, I'm gonna read credentialing report. We had a meeting to review and approve them with the team on July 9th. The facility Fort Bell, Meredith Moss, physician assistant, initial application. We approved and reviewed that. Do you want me to mention them all and then ask a motion for approval or go by facility?
At the end, a collective one will be fine.
Okay. Then the second facility, Las Lunas, LLCP, Dr. John Gatling, that was an initial application. NMBHI, Edward Baca, LPCC, reappointment. Dr. Paul Bagwell, reappointment. Dieter Boxman, clinical nurse practitioner, initial application. Dr. Christopher Clancy, reappointment. Dr. Teresa Carvel, psychologist, reappointment. Dr. Wendy Demet, MD, reappointment. Dr. David Elliott, MD, initial application. Dr. Dusty Humes, PhD, reappointment. Dr. Timothy Cockler, PhD, reappointment. Joyce Meserve, nurse practitioner, reappointment. Dr. Richard Nail, reappointment. Dr. Douglas Puryear, initial application. Dr. Carl Ray, reappointment. And Deborah Stanley, PhD, reappointment. New Mexico Rehab Center, Dr. Stephen Black, reappointment. PhD, facility PhD, Dr. Thomas Macero, initial application. And Dr. Maximo Torres, initial application. There are no credentialing report for Sequoia or Turquoise Lodge. We approved the credentialing during that meeting on July 9th. Can I have a motion to approve these individuals?
So moved, this is Todd.
And a second,
Second, Carmella.
all those in favor?
Aye.
And anyone opposed? Seeing no opposition, the credentialing is approved. Thank you, Dr. Ryan, for your continued coverage of this role and for your presentation today. I appreciate it.
Okay, thank you, everybody.
So any announcements? The next meeting of this governing body will be on October 18th, Thursday. And we'll probably be talking a lot more about transition as things continue to move forward in the year. So please make sure that you're working on those transition documents. We may either in October or December do a presentation of some of the things we're looking at in terms of handing the torch over. So please be prepared for that. And now we're moving to the public comment. Does anybody have any comments or questions they'd like to make at this time, or this is just comment? I'm staring at Eric as he's our public and Mary Beth. So thank you. We're going to adjourn right now to our closed executive session. We will not take a vote on anything during our closed executive session. If you are not part of the governing body, if you can excuse yourself. Can I go back on the record now, so to speak? And we're adjourning our closed executive session and reopening for our public session. Just for the record, we do not take a vote on any matters during our closed executive session. So, does anyone have anything else to present to the public and the full governing body? Seeing nothing, if I could have a motion to adjourn the meeting.
My motion.
And a second.
Second, Carmella.
Meeting of the governing body is adjourned. Thank you, everyone.